Physical therapy as a career. Firstly, let's look at what do physical therapists actually do. Physical therapists perform routine diagnostics and exams on their patients. They do this in order to establish a baseline or a standard of which they can build upon in order to prescribe effective exercise programming. Physical therapists also care for patients. For example, you could have a 5-year-old patient and a 95-year-old patient come in one after the other, and you as a professional need to understand their own needs and also be able to communicate what you want them to do in an effective way. Physical therapists also must record everything. If you don't record everything, the law and the insurance has no way of knowing that the interactions with your patient actually happened. And if something bad were to ever happen to one of your patients and they were to pursue legal action against you, you would need this hard evidence or this hard reference in order to prove what actually happened between you and this patient. You also must develop professional relationships, not only with your customers, but with other professionals as well. For example, that could be other physical therapists in the area, other doctors, or other occupational therapists. Now that you've seen what a physical therapist does, what skills do you need in order to fulfill this role? Well, firstly, you need to be able to comprehend a vast array of medical terminology and skills. Some of these skills could include goniometry. For example, we have a goniometer present on the infographic. You also need to be able to perform skills like a heart rate examination or a blood pressure examination or neuromuscular rehabilitation. And understanding medical terminology is so important, not only for your own record keeping, but for understanding other doctors' reports and referrals as well. You also must be an active and critical thinker as a physical therapist because you're going to have to think clinically and critically for each individual patient's case in order to establish an effective workout and exercise program for them that's going to promote the best recovery possible. You also need to be socially and orally accommodating to your patients in order to make them feel welcome and well received and make it feel like their time is being utilized wisely. And building on that, as a professional, you must be service oriented. You are not a gym. So, for example, do not put your client on an elliptical for 30 minutes and leave them alone, especially if their entire session is only 45 minutes. Actively engage with your patients and develop relationships so that they feel like their time is being well utilized. So now that you know what a physical therapist does and how you can hone your skills in order to fulfill those roles, what do they earn? Well, on average, physical therapists earn $97,720 annually, with a very high career growth rate of 9% or higher for this calendar year. And there's around 13,900 job openings in the United States currently. In the middle of the infographic, you can see a graphic that supports the annual mean wage of physical therapists by state. As you can see, in some of the more industrialized states, there are some higher mean wages, but that is always the case with occupations, especially in comparison to more rural states. So what can you do to become a physical therapist right now? Well, you can start by shadowing local physical therapists or becoming a physical therapy technician. You can do this in order to diversify your understanding of the vast world of physical therapy and expose yourself to this giant world that is physical therapy to really hone in on what it is you want to do. You also need to maintain a 3.0 GPA, especially in your physical therapy prerequisites like biology 1 and 2, physics 1 and 2, chemistry 1 and 2, and psychology. You also need to develop connections, not only with professors or with other students alike, but with patients while you're doing this shadowing. For example, you need to communicate with patients. You can try to simplify the process of communicating for them. You can reward patients' loyalty and keep them as informed as you want to, and also continuously add value to every interaction you have with patients. And finally, you need to go to a doctorate of physical therapy program in order to become a fully licensed physical therapist. Thank you.